welcome back to Onceuponamolar, where we make learning easy for you. So our today's topic is just going to be a continuation of the topic that we covered last time from the heading of disturbances in sense, which is the first chapter of your contemporary of oral pathology. And last time we did microdontia. Today we're going to be doing a term or a topic which is the complete opposite of microdontia. So today we're going to be starting with macrodontia, okay? So by its name, macrodontia, it is also called megalodontia. And basically what happens in macro, the words itself are self-explanatory, okay? So macro and megalo, basically you can understand quite easily that it means that there is something which is mega or big or gigantic, something like that, okay? So macrodontia means that there is an increase in the size of the tooth, okay? So whenever you're asked for the definition, you can just go ahead and break down this word, and you can write one or more teeth which are larger than normal, okay? So it can be one, it can be more, it can be all, okay? So you just need to be aware that it can be one or it can be more. So the teeth which are larger than normal is known as macrodontia. So we have a few types here. Just gonna move this down a little bit so you can appreciate that. There we go. So what happens is that we have the same terms as we used in microdontia, but just like the definition, the whole explanation is going to be like complete opposite of microdontia, okay? So for the first type of macrodontia that we have the localized type, okay? So this, as we talked about it last time, localized means that something which is localized or confined to a certain area, okay? So if one or two teeth are involved, that is known as the localized macrodontia, okay? And the most common teeth which are involved are seen to be in the upper arch, which are the upper central incisors, okay? So just so you know that the localized type of macrodontia, it is quite rare as compared to the localized type of microdontia, which is quite common, because we saw the example of peg laterals, which are very common. But when it comes to the localized or a single tooth which is larger than normal, yes, they do occur, but it is quite rare, okay? So here we have two terms, hemifacial hypertrophy and segmental odontomaxillary dysplasia, okay? Now these are the two conditions where you are most likely to find the localized type of macrodontia, okay? So what happens in hemifacial hypertrophy, I'm just going to explain both of them briefly, is that in hemifacial hypertrophy, hemi means half, facial means your face, hypertrophy means when there is an increase in the cell size and number, okay? So what happens is that the people who were affected with hemifacial hypertrophy, what happens is that it the whole one side of that person, it can be either left, it can be either right. It is larger or more growth, like it has more growth as compared to the opposite side, okay? So let's suppose that if a person is growing and a person has a right side and a person has a left side, okay? So the right side is growing at a normal pace, everything is good, but for some reason it could be genetic, it could be due to mutations, that the patient's left side, it is growing more faster and it is getting more hypertrophied, okay? The correct word is hypertrophy, like it is increasing in size, okay? So that whole side, the one which is affected, you will see that there is a increased size of soft tissue, increased size of hard tissue, there is increased size of organs, even vital structures, the eyes, the teeth, the jaws, everything is going to be increased in size, okay? So hemifacial hypertrophy, this is where you are most likely to see the localized type of macrodontia, because everything is just going macro at one side, okay? Hemifacial, half, okay? And the other one that we have is segmental odontomaxillary dysplasia. Fancy term, but if you were to like break it down, so what happens in segmental odontomaxillary dysplasia is that you have two jaws, okay? You have the maxilla, you have the mandible, okay? So what happens here is that it only affects the maxilla, okay? So what happens over here is that the maxilla, that too is not fully involved, okay? Segmental. So let's suppose that this is we're gonna divide our maxilla in half. Only one segment, okay? Only one side of the maxilla is going to be affected, okay? And there is a increased size of that segment. The teeth can be affected. Usually the teeth are malformed, they have failure to erupt, and this is exactly where this whole segment is where you can find the localized macrodontia type. It is usually from the premolar to the molar area, so the posterior segment, okay? That is where the dysplastic changes occur, okay? And you can see some degrees that there is an increase in alveolar bone, okay, an increased size. So here you're also most likely to find the localized type of macrodontia, okay? Next up we have is the generalized type. Generalized by definition something which is over a larger span, and if all the teeth are involved it is going to become a generalized type, okay? So what happens, here's a picture to demonstrate that, is that for example this is your normal arch, but look at the size of the teeth. If this is the normal size of the teeth, you can look at how, well, it's a bit exaggerated, but you get the picture, okay? Just for your understanding, you can get that the teeth are larger, okay? And all of the teeth are large, not just one, not just two. All of the teeth are large, okay? So generalized, we're just going to further break it down for your understanding into two more types, which is the true generalized and the relative generalized, okay? True generalized, basically what happens is the true generalization has its effect via the pituitary gland, okay? So let's say, for example, there is an oversecretion of the growth hormone and due to some malfunction of your pituitary gland. So what happens is that the patient goes into pituitary gigantism, okay? So when that happens is that the patient is more prone to growing more excessively, and they usually are very, very tall, very developed, and those people are more prone to having, since everything that they have, all of their body parts, all of their soft tissue, hard tissue, they're going to be, or their viscera, they're going to be more increased in size. Then of course their teeth are going to be more increased in size as well, okay? So just remember that true generalized is always associated with your pituitary gland, okay? So just to recap, if you can remember what true generalized meant in microdontia, if you can guess the condition that it was affecting, it was pituitary dwarfism, okay? And over there we were having the exact opposite, that we were having generalized microdontia. Over here we're having generalized macrodontia, okay? Lastly, we have another term for generalized, which is the relative generalized, okay? So when it comes to the relative generalized, just look at the definition, that when the size of mandible, maxilla, or both is small. Now, in this case, it's a bit tricky, but very interesting, that let's suppose that your jaw size, okay? Your teeth are normal, your teeth are of normal size, they're good to go, their mesiodistal widths are normal, they're falling in the normal ranges. But what happens is that when you look at the patient, you see that the teeth appear larger. But when you examine the patient and you make some diagnosis, and the diagnosis is that the jaw size is actually smaller. If let's suppose if this is your normal size of the jaw, and this is the size of the jaw that is present in the patient. So even if the teeth are of, let's suppose if these teeth are present in a normal jaw, it is impossible for these teeth to accommodate in this space, okay? There's going to be some crowding, or there's going to be like these teeth won't be able to accommodate themselves in a smaller space, okay? So what happens here is that the teeth are going to have a deception, or they're going to appear larger, okay? So those teeth are actually normal, but the actual problem lies in the size of the jaw, okay? So over here, we have just one more term that we have to go through. It is similar, falls under the heading of macrodontia, and I'm just going to write it down here. If you can appreciate that, I'm just gonna erase this. Okay, so this term is called rhizo Okay, rhizomegaly or radiculomegaly. Okay, so the term rhizomegaly or radiculomegaly, they mean the same thing. Megaly means larger, and rhizo or radiculo comes from the root. Okay, so if this is your tooth, okay, this is the crown, and here we have the root. Okay, we talked about this portion where we're talking that the size of teeth is normal, they appear bigger. Now we're going to be talking about what if the root is long. Okay, what if you look at an x-ray and you see that the root, if a normal root is like this length, you see that it is this length. Okay, that is known as rhizomegaly. Okay, when the roots appear longer in size as compared to the other teeth, or as what usually happens is that the canines, okay, so the lower canines are the teeth which are most affected by rhizomegaly. Okay, so whenever, if you get an MCQ, if you get anyone who asks you write a note on rhizomegaly, the only thing that you have to write over here is that rhizomegaly or radiculomegaly basically means that there is an increase in the length of the roots. Okay, and the most commonly affected teeth are the lower canines. And with that, we're going to be wrapping up our topic of macrodontia. Okay, just remember the definition: one or more teeth larger than normal, localized, generalized, and forward we have two more types of generalized. Localized, usually rare, and has two of the uh, conditions which affected the most: hemifacial hypertrophy and segmental odontomaxillary dysplasia. Secondly, we have the generalized type in which all the teeth are involved. Okay, so generalized, we can have true generalized, controlled by the pituitary gland and due to pituitary gigantism. Then we have the relative generalized, which is due to the small size of the jaw. And lastly, we have rhizomegaly or radiculomegaly, in which the roots, they are longer in size as compared to what normally is expected. Okay, so the most affected teeth are the lower canines, and for the localized type, the most affected teeth are usually the upper central incisors. Okay, and with that, I hope that you understood that. And next time we're going to be covering more topics from the same chapter. And I hope that if you have any suggestions, any comments, or any feedback that you would like to give, I would be looking forward to that. And have a good day, guys.